This is Brenda from speech class, and I'm recording my audience, and now they are going to take a seat, and I will be doing my speech. So, imagine that you've just given birth to a baby. Your baby is handed from the doctor to the nurse, who is a few feet away from your bed, and places your baby on a radiant warmer. She dries and stimulates your baby, checks your baby's heart rate, respiratory rate, and temperature. She moves on to get footprints on your baby, applies identification bands to your baby, then she puts antibiotic eye ointment in your baby's eyes. Then she moves on to the scale to get the weight of your baby. After this, she wraps your baby up in a couple blankets, puts a hat on, and finally hands you your new baby, who you've been waiting to hold for 9 months. This whole process can take anywhere from 15 to 20 to 30 minutes. At about 30 minutes, the nurse comes over to you and says, "Okay, it's time to start breastfeeding your baby. You're just trying to get to know your baby." So the nurse is trying to get you to breastfeed, which is sometimes a bit of a struggle. And after an hour, even if the baby's breastfeeding, the nurse says, "Okay, the baby needs to go to the nursery. We need to check some more vitals, give the baby a bath, and put it back into the radiant warmer so that it can be warmed up." So before you know it, your baby's taken from your room, and you're left sitting there without your baby. Well, today I'm going to be talking to you about skin-to-skin contact. This is when the baby is put on the mother's chest for the initial hours immediately after birth, and kept there uninterrupted, and during this time there are many benefits to the mom and the baby. Skin-to-skin contact would be as soon as the baby is born, the baby is taken and placed on the mother's chest like this, with blankets placed over the baby. This evidence is supported by Emily Carcuna in her article on the Journal of Advanced Nursing. She talks about how important these first initial hours of skin-to-skin contact are with mom and a baby, because this is when the baby is the most alert. The period of time that the mother and her baby are in skin-to-skin contact has many physical and psychological effects for mom and baby. I will start by sharing with you how they affect the mom. According to Dawn Henderson, when baby is put in skin-to-skin contact on mom, the presence of the baby causes the hormone oxytocin to be released. The baby is also putting pressure on the mom's abdomen, so along with the oxytocin and the baby putting pressure on the abdomen, this is helping the blood flow to be decreased after the delivery, which is an important process. The oxytocin also causes breast milk to be released. The baby will find its way to the breast and latch, which gets the breast milk production started. While the baby is on the mom, blood vessels are dilating in the mom's chest and around her breast. This is making her chest warm, increasing the temperature, which is helping to keep her baby warm. This process can take longer than an hour, and that is why it is very important that this mother and baby are kept together in this crucial time. Some benefits, psychological benefits, are the mom gets to hold and bond with her baby. According to Henderson, this bonding time continues the release of oxytocin, along with the prolactin hormone, which decreases anxiety and has a soothing effect for the mom and the baby. Studies by Ann Bigelow and colleagues reported that skin-to-skin contact help mothers have more positive feelings towards their baby, have decreased postpartum depression, and mothers felt empowered in their parenting of their new baby. The mom is not the only one benefiting from this. The baby is benefiting also. According to Niels Bergman, taking baby from mom causes baby to go into a state of despair. It has been taken from the only familiar place that it knows, the womb, and the womb provided food, warmth, and protection for the baby. By placing the baby in skin-to-skin contact with mom, the baby is getting these needs met. It's kept warm, it's getting food, and it's calm because it's protected by its mother. While the baby is calm and is able to start breastfeeding, this process can take up to 45 minutes to even get a baby to latch. If this latch is interrupted, the feedings thereafter can be ineffective for the next few days. According to John Kennel and Susan McGrath, when baby's in skin-to-skin contact with mom, it will warm up and stay warm. So whether you're breastfeeding or bottle feeding your baby, it is very important to have baby in the skin-to-skin contact. Most moms, I think, would agree that they want a baby who doesn't cry very often and who sleeps a lot. Well, according to Henderson, a baby that is placed in skin-to-skin contact is usually in the flexed position that it was like in the womb. This causes the baby to have less purposeless movement, causing the baby to cry less and sleep longer, which will help it to grow and also give the mom time to rest. Some of the psychological benefits for the baby, according to Larry Gray and his colleagues, babies that were in skin-to-skin contact during their vaccination shots and heel sticks for blood sugar checks, decreased less pain, and cried less than babies who were not in skin-to-skin contact. So is it also very important for that process. The baby's emotional needs are also being met. Henderson said the oxytocin that is released is also released in the baby, which will stimulate an increased trust and decrease fear and anxiety in a baby, making the baby feel safe and secure. So there are many benefits for mom and the baby. Bergman summed it up nicely by saying, kangaroo care, which is the same as skin-to-skin contact, does a very profound thing. It returns the baby to its mother. So I hope you have learned a few things today about the importance of skin-to-skin contact. And in the event that you have a newborn, that you take those few hours immediately after birth, snuggle that baby up on your chest, and savor that time with your baby. Thanks for your time. And then here's my audience again.
You're still here?
Thank you.
Did you make any sense?